Hi everyone, today we're going to be talking about cardiorespiratory exercise. So this is actually one of my favorite topics to talk about because I love cardio exercise. The amazing benefits that it does to you is just incredible. So let's get into that. So here is a little overview that I have for you for our presentation. We're going to be looking into what is cardio exercise. We're going to also look into factors that affect your cardiorespiratory fitness or cardio fitness. We're going to be looking into the benefits of cardio exercise, and we're also going to be looking into what's called the FITTE principle for cardio exercise, which are guidelines that we recommend for people to do when performing cardio exercise. We're also going to be looking into the different types of activities that are considered cardio. Okay, so let's get into this. And what is cardio exercise? Well, cardiorespiratory exercise, also known as cardio, like I've been saying, cardio exercise, also known as cardio, also known as aerobics. It's actually any form of continuous movement lasting 10 minutes, at least 10 minutes or longer. And this is going to use larger muscle groups like your legs, okay? And it's going to increase your heart rate, okay? You're going to start feeling it when you're doing cardio. Like when you're doing cardio because your heart rate starts to pump faster, you start to breathe harder, because that means that, the demand for oxygen is increasing and your heart has to pump faster, so in order to be able to deliver this oxygen to the body. So you feel it and you start to sweat, and you feel this is a cardio exercise. Again, looking back into heart rate increasing, okay, you start to gasp a little bit for air, okay. So we have different types of cardio exercise, like running, hiking, that's Zumba, that's a type of cardio activity, okay? Now, when we talk about cardio, or specifically aerobic, cardio aerobic is pretty much related to the same thing, but the word aerobic means with oxygen, okay? Now, that's the thing, that what we're doing here when we're performing cardio or aerobic exercise, we're actually increasing the demand of oxygen to our muscles, our legs mainly. Like, let's say when you're running, your legs you're running, right? Your muscles are contracting, they are actually going to need energy. And now, to be able to your muscles contract, we need oxygen, and oxygen is going to be needed in order to produce energy, which is actually ATP, what we on the cellular level. But so it actually means with oxygen. Aerobic means with oxygen because we need it. We need oxygen when we're doing cardio. And it's actually, again, like I mentioned, it's needed for the muscles to function, okay? So again, you will feel when you're doing cardio, you will know, okay? Now, when we look into how to assess, and we also use the word your cardiorespiratory fitness or your aerobic fitness, we can actually assess it through what's called VO2 max, okay? Because cardio exercise is the activity, okay? The activities that you're doing, right? You're doing cardio activities now that are going to increase the demand of oxygen, that is going to increase your heart rate and all these things that we talk about. Now, the more we do this, well, this is going to be good for us because it's going to help our aerobic fitness. It's going to improve our aerobic fitness. And our aerobic fitness is actually, it's actually based on our heart, how strong is our heart. It's also related to our circulatory system, okay? So the more cardio we do, we're going to be improving our aerobic fitness, our aerobic capacity. It's pretty much the same thing. And how do we know, how do we find out our aerobic capacity, our aerobic fitness? Is through what we call VO2 max, which is maximal oxygen uptake, okay? So this is actually a good indicator of our aerobic fitness level. And VO2 max is actually looking into how efficiently our cardiovascular system can deliver oxygen to your muscles, and your muscles being able to use this oxygen. Because one thing is, we need to deliver that oxygen through, again, oxygen being delivered through the blood, pumped by the blood, and then getting it to the muscles, and now your muscles being able to use it, okay? Now, how do we assess our cardiorespiratory fitness? we can actually, the most accurate actually is going to be a way to assess your cardiorespiratory fitness. A way to assess your VO2 max is going to be performed in the lab, in the laboratory test. Now, you have a special equipment, you have a special training, it's pretty expensive. Now, we can assess it like you and me, we can go perform tests and we can assess and we can have an idea of our aerobic fitness, our VO2 max. We can actually perform what's called submaximal tests, and they are performed in the field. So these are called field testing. And this type of test, it's like anyone can perform them. It doesn't require expensive equipment, much training, such as the Cooper test. The Cooper test is a 1.5-mile running test, and you're running for distance, and you calculate your VO2 max by how long it took you to run that distance. Sometimes we use a formula, or sometimes we just calculate it through the time that it took you. The rapport test is a walking test. It's actually, if you're doing the track, it's about 4 laps on the track. Or if you're doing distance, just 1 mile, you're brisk walking, fast walking, and then you're going to get your time, you're going to get your heart rate, and then you're going to plug those numbers in a formula, and then you're going to get an idea of your VO2 max, your maximal oxygen uptake. And again, this is going to give you an idea of your aerobic fitness, because the lower your aerobic fitness, possibly you can put you at risk of cardiovascular disease or diabetes. Okay, so you don't want to have a low aerobic fitness. That might also indicate that you are not living a successful life. Okay, you might be getting tired too pretty quickly when you're going to the second floor, right? You shouldn't be getting tired when you go to the second floor, or that you don't have too much energy through your day. So that might be an indicator that you don't have a good aerobic fitness, a good aerobic capacity, and that's not good for us. Okay, we want to work in our cardio. Again, cardio is going to help us in prevention of chronic disease too. Okay, so let's move on to the next slide, which is looking into factors that affect our cardiorespiratory fitness. We have different factors, and we have one of them, which is genetics. Genetics is actually how we were born, okay? And there are some factors that genetics we don't have a choice. We were born with that, like high blood pressure, hypertension can be inherited by our parents. And this is hypertension, means this high blood pressure is actually the increased resistance in the blood flow of the arteries of the heart. Okay, so that can actually put you at risk of cardiovascular disease. You have high blood pressure. Now, gender, meaning males or females, can have an effect in our aerobic fitness, our cardiorespiratory fitness. For example, males tend to have a bigger heart, and which bigger hearts are going to allow males to work harder, to be able to last longer, okay, than females, because also males are bigger than females, right? We're smaller than males physiologically. We're looking into physiology, okay? So, and then therefore also males are going to be able to adapt fairly quickly to cardio exercise, but males are going to be at a higher risk of heart disease. And this is kind of we've been seeing. Like what we've seen with the statistics is that males are more prone to heart disease than females. Now, the next factor that can affect your cardio fitness, your aerobic capacity, it's either smoking, like environmental influences, like smoking, like drinking alcohol in excess, taking drugs, poor diet. These are all things that can have an effect. Now, the thing with smoking also is smoking can put you at risk of lung cancer, okay? Poor diet also can have an effect on how well is your aerobic fitness. So we continue to the next slide. Let's look into the benefits of cardiorespiratory exercise. This is actually my favorite slide, looking into the benefits of cardiorespiratory exercise. Like I mentioned before, cardio exercise is going to help us in prevention of chronic disease, decrease the rates of cardiovascular disease, stroke, type 2 diabetes, and some kinds of cancers. Okay, it can also help us lower our blood pressure. It can help us lose body fat, because what happens with cardio exercise is that you need energy, right? When you're running, when you're dancing, you need energy. Your body needs energy. And what you're going to do is you're going to be able to burn calories. So what's happening is when we're trying to lose weight or when we're gaining weight, it's all about calories in, calories out. So if we're trying to lose weight, we want to create a deficit that we're actually burning more than what we eat, okay, than what we consume. So when we start, we create this deficit by exercising, increasing the amount of energy that you need, the amount of calories that you're burning. And then if you don't eat as much, then what happens is that when you need that energy, your body's going to go to the adipose tissue that's being stored, and it's going to use that energy for the exercise. And that's how it's going to help you to lose body fat, okay? So it helps to create this deficit where you're needing more energy, right? Because you're exercising, you need more calories. And if you're not eating as much, then you're actually going to have to go and use the stored fat to be able to use that energy, okay? And that's also going back related to increasing your metabolic rate at rest. Metabolic rate relates to the chemical reactions in our body, in the cellular level, what's happening in the cells, right? So when we do more cardio exercise, we are actually going to increase our resting metabolic rate. So at rest, we're going to actually be able to burn more calories than a normal person that doesn't do as much cardio will do. So at rest, we can burn more calories than a normal person will be doing. Okay. Now, the thing with these two is that if we possibly increase more of our lean muscle mass, we can actually we will be able to also be more metabolic active, okay, and be able to burn more calories during rest, because muscle is going to be more metabolic active, it's going to need more energy. Now it can also help us improve the capacity of the heart. So increasing the size of the heart, specifically the left ventricle, can increase, and your heart will become stronger and it'll become more efficient at delivering that oxygen to your body. It can also help reducing stress, okay? And this is all the psychological part, that is, it can help us reduce the stress. It can help us also with feelings of depression. There have been studies that have been shown that cardio exercise can help with depression and anxiety. It can also improve your mood. This is what happens, is that your body releases, when you do cardio, your body releases what's called the endorphins that make you feel good, endorphins. So your body actually, these are hormones that it just makes us feel good, and it improves our mood and we feel happier. Okay, so let's continue. The next slide is looking into the FITTE principle of cardio exercise. So we're looking into, we talk about these benefits, and now we're looking into, okay, how much cardio should I do? What is recommended, right? Well, here are the guidelines. The ACSM, which stands for American College of Sports Medicine, recommends that in order to prevent chronic disease, we actually should be exercising most days of the week, moderate intensity, for at least 30 to 60 minutes. So the FITTE principle is actually some guidelines that we use to recommend cardio exercise. It's an acronym that stands for frequency, intensity, time, type, and enjoyment. So again, the ACSN recommends that we do moderate intensity exercise 5 days per week for 30 to 60 minutes in order to prevent chronic disease. And now you can see here, frequency relates to how many days per week? 5 days per week. Intensity is a moderate intensity. Now, how do you know the intensity? Well, if you want to test it and you're working on the treadmill, it's like when you should be at a pace that you're able to answer a question if I ask you, or be able to say a couple sentences, right? But it's not like you're having a great time, you're laughing, you should feel it, that you kind of gasping for air, okay? You want to actually, if you can work at a harder intensity, at a higher intensity will be better. But when you start, you probably want to take it a little bit easier so your body gets used to. At least 30 minutes, again, 30 to 60 minutes. Cardio activity type, is it running? Is it jogging? Is it Zumba? Is it kickboxing? Okay? And enjoyment, we want you to make sure that you pick something that you like. That's all it means by enjoyment. Make sure that you pick something that you like. So, types of cardio exercise, we discussed this a little bit, but we have cardio machines like the treadmills, the rowing machine, bikes, elliptical. These are the equipment that you see in the gym. Okay, aerobic classes like Zumba, okay, kickboxing, water aerobics, HIIT. These are the high intensity interval training. These are the group classes, okay, aerobic classes or cardio classes. We also have recreational activities like sports, like soccer, basketball, okay. And the last thing I'm going to talk about is progression for cardio exercise. So I always say this: if you never exercise, if you've never done cardio and you're brand new, okay, I recommend for you to start with small steps at a time. Now, what happens a lot is that people get so excited about starting a workout program, and which is awesome. I love that. However, a lot of times we're like, I'm going to work out every single day. The problem is that if you never exercise and you haven't exercised for a little bit and you want to work out every day, it's just going to be too much for your body. You want to start with small steps at a time. You want to get your body used to the activity, allow your body to adapt to the routine, because when you're doing cardio, you're putting a stress on your body, allowing your body to adapt. And then once you feel you're okay with that, then you can add more days. So maybe let's say you feel like, okay, I can only do 2 days per week, 30 minutes. Then that's okay. If that's all you can do, then start with that. Make sure you do it. Let's say you're doing it for a month. You're committing yourself for 2 days, 30 minutes, and you do it for a month. And then you can reassess. And after a month, you can say, okay, can I do more? Okay, let's see. Then maybe we can add a little more time of your session. Maybe instead of 30 minutes, now you can do maybe 35 minutes, okay? Or maybe 40 minutes if you can add it. Then from there, maybe you say, oh, I can have 40 minutes. Then if you see in your routine and you see, you know what, I think I can do another day, then add another day. So slowly building yourself up to that. So again, working out every single day, I love the idea. I mean, we should always have like a day of rest, but I like the idea of working out most days of the week. However, it's where you are. If you have been exercising regular basis and you want to add more days, then that's great. I love that, right? But again, build yourself up to that. Don't want to start all soon, because this is what I see when I teach my classes at the gym. I see everyone getting excited at the beginning of the year, and then you're doing every day, working out every day, working at high intensities, and then 2 months later you drop. You don't want to do that. You want to make sure that you pick something that you like and you can commit to that. Okay, hopefully you like this presentation. Thank you very much, and until the next time.